Welcome to The Explainer. Today we're exploring a fascinating and honestly absolutely crucial topic about how our bodies actually communicate with us. Think back to the old days of coal mining, right? Miners used to carry these little canaries down into the tunnels with them. Why? Well, because those small birds were incredibly sensitive to dangerous invisible gases. If the canary stopped singing, it was an early warning sign that something in the environment was dangerously wrong. It gave the miners a chance to act before it was too late. Well, guess what? Our bodies have their own built-in canaries, and today we're talking about a biological warning system that is far too often ignored, usually because of embarrassment or stigma: erectile dysfunction.
So let's dive right into this. Could your sexual health actually be a warning sign for your heart? The medical data we're looking at today reveals a completely surprising and, frankly, critical connection between erectile dysfunction and your systemic vascular health. We really need to reframe how we think about this. It's not just some isolated, embarrassing performance issue. It is a very literal, very clear window into your entire circulatory system.
Here's our quick agenda for today's explainer. First, we'll cover understanding erectile dysfunction. Second, causes and overall health. Third, we're busting common ED myths. Fourth, treatments and lifestyle changes. And finally, communication and the future. Let's get to it.
Starting off with Section 1, Understanding Erectile Dysfunction. So what exactly is it?
My goal right out of the gate here is to completely destigmatize this condition. The clinical definition of erectile dysfunction, or ED, is simply the ongoing difficulty getting or keeping an erection firm enough for sexual activity. And I really want to highlight that word, ongoing. Now yes, ED can heavily affect a person's confidence, relationships, and overall mental well-being for sure. But looking at it strictly through this medical lens helps remove the shame so we can actually address the mechanics of what's happening.
There's a really clear contrast we need to make here. On one hand, we have occasional erection problems. Look, this is totally normal. It happens to people because of stress, tiredness, maybe a few too many drinks, or just temporary emotional pressure. The body isn't a machine, right? But on the other hand, we have persistent ED. If these issues are frequent and they're consistently disruptive, well, that's when it crosses the line into a condition that requires a proper medical evaluation. It's so important to validate the normal, temporary hiccups we all face, while also highlighting exactly when it's time to seek professional help.
Moving right along into Section 2, Causes and Overall Health.
The canary in the mine.
Let's deeply explore that canary in the coal mine concept and see exactly how ED acts as a barometer for your entire physical state. According to the Mayo Clinic, ongoing erection problems may be a sign of a health condition that needs treatment and may also be a risk factor for heart disease. See, this is a highly recognized standard medical issue. If the canary in the mine stops singing, you don't just treat the canary, right? You look at the condition of the entire mine. Seeking treatment isn't just about sexual health. It's absolutely crucial for safeguarding your long-term cardiovascular health.
Let's break down some of the physical causes: diabetes, high blood pressure, high cholesterol, heart and blood vessel disease, obesity, and low testosterone. The biological mechanism going on here is genuinely fascinating. Erections rely incredibly heavily on healthy, unobstructed blood flow. Because penile blood vessels are much smaller than the arteries going to, say, your heart or your brain, they're usually the very first ones to get clogged or damaged. Because of that, erection problems often appear months or even literally years before other major cardiovascular symptoms like chest pain. It really is your body's early warning system.
But hey, it's not just about the plumbing. Your brain and your daily habits play a massive role too. Psychological and lifestyle causes include things like stress, anxiety, depression, relationship difficulties, smoking, excess alcohol, and poor sleep. Think about it from an evolutionary standpoint for a second. When you're chronically stressed or sleeping terribly, your nervous system shifts into this fight or flight state. Biologically speaking, if your body perceives that it's under attack or stuck in survival mode, it completely shuts down non-essential functions. It literally makes it physically, mechanically harder to relax the smooth muscles necessary to maintain an erection. So, if you are experiencing these symptoms, the next logical step is obviously the doctor's office. And let's demystify that diagnostic journey right now so you know exactly what to expect. And hopefully we can reduce any anxiety about actually seeking treatment. Step 1 is just a simple conversation, taking a medical and sexual history. Your doctor will ask when the symptoms started and check in on your stress levels. Step 2 is a basic physical examination, and Step 3 involves specific tests, like a quick blood draw to check your glucose, cholesterol, and testosterone, along with a routine urine test. That's the whole shebang. It's a standard, straightforward workup designed simply to check your overall machinery.
That brings us to Section 3,
Busting common ED myths. Fact versus fiction.
It is definitely time to break down some of the societal misconceptions that cause so much unnecessary shame and, worst of all, cause people to delay the treatment they really need. Like, is ED just a normal part of aging or simply a lack of attraction to your partner? These are arguably two of the most damaging stigmas out there. They isolate men, they make partners feel completely inadequate, and they totally derail the conversation from where it actually should be, on health and wellness.
So, the crucial point is this reality check. ED affects men of all ages. Yes, okay, it may be more common as we get older, but it is absolutely not an inevitable, unfixable decline of aging. It has very distinct physical or emotional causes, and most importantly, it is highly treatable. It does not automatically mean a lack of attraction. It's a standard medical condition, full stop. It is not a personal flaw.
Let's shift gears to Section 4, Treatments and Lifestyle Changes. Actionable solutions.
Once we know the root cause, there are just so many effective medical and holistic solutions available. First up, let's look at the common, evidence-based medical treatments. The primary first-line medications are PDE5 inhibitors. You'll probably recognize these as sildenafil or tadalafil. They work by directly improving blood flow to the area during sexual stimulation. But if pills aren't the right fit, doctors have an array of options like vacuum devices, penile injections, or even testosterone therapy if your hormone levels are actually confirmed to be low. One incredibly important note here, though. Doctors will always carefully review your overall heart health and medication interactions first, especially if you're taking nitrates for chest pain, just to ensure these treatments are completely safe for you.
Beyond the pharmacy, though, your daily habits wield incredible power. The National Institute of Diabetes and Digestive and Kidney Diseases states that lifestyle factors can lead to or worsen ED. Changing daily habits may help prevent or improve symptoms. I really want this to empower you. You have a tremendous amount of agency over your own health. Taking control of your daily routine directly impacts your vascular health, which, as we know, directly impacts your sexual health.
A vital part of those habits involves supportive, heart-healthy foods. We're talking about leafy greens, berries, fatty fish, nuts and seeds, whole grains, and olive oil. What we're essentially looking at is the blueprint for a Mediterranean-style diet, because vascular health is the literal foundation of an erection, a diet that clears out your arteries, lowers inflammation, and supports cardiovascular circulation is directly going to help you overcome ED. By eating these foods, you are quite literally eating to protect the canary in the coal mine.
And finally, Section 5, Communication and the Future, the Path Forward.
We absolutely have to address relationship dynamics. Open communication helps reduce shame, it eases performance pressure, and it makes seeking medical help a shared journey. ED takes an immense emotional toll on both partners. Avoiding the topic just increases the anxiety in the room, which, as we learned earlier, triggers that physical fight-or-flight response, making the symptoms even worse. Opening up to your partner isn't just a nice thing to do, it's a critical, foundational component of effective treatment.
So, where is the future of proactive care heading? First, individualized medication plans. Second, better cardiovascular risk screening. And third, integrated sexual and mental health. And this brilliantly illustrates how the medical community is shifting its entire paradigm. Instead of just treating ED as a standalone performance issue, doctors are now treating it as a holistic health marker. They're treating the whole patient, integrating cardiovascular risk assessments right alongside sexual and mental health support. It's a real game changer. Which brings us to our final powerful thought for this explainer. If your body is sending you a message, are you ready to listen? Don't let societal embarrassment keep you in the dark. Your body is an incredibly smart, highly connected system, and that canary might just be trying to save your life. Talk to your partner, talk to your doctor, take control of your lifestyle, and embrace the power of proactive health. Thank you so much for joining me on this explainer, and as always, keep learning.